Insertion of tube inside the stomach through the nose is called nasogastric. A. Irrigation. B. Extubation. C. Irrigation. D. Intubation. And the correct answer is D. Intubation. Nasogastric intubation is a medical process involving the insertion of nasogastric tube through the nose and down into the stomach. The process in which a nasogastric tube is inserted, the stomach is flushed and ingested substances is removed through the tube is called A. Colonic irrigation. B. Gastric lavage. C. Decompression. D. Gastric gavage. And the correct answer is B. Gastric lavage. Gastric lavage, also commonly called gastric irrigation, it is process of cleaning out the content of stomach. The term gastric gavage indicates A. Giving liquid feeding into stomach. B. Visual examination of the stomach. C. Irrigation of the stomach with a solution. D. A surgical opening through the abdomen wall to the stomach. And the correct answer is A. Giving liquid feeding into the stomach. The gastric gavage is a way of giving medications and liquids through nasogastric tube into the stomach or small intestine. A feeding tube placed directly into stomach through the artificial opening on the abdominal wall is called A. Nasogastric tube. B. Nasoduodenal tube. C. Gastrostomy tube. D. Jejunostomy tube. And the correct answer is C. Gastrostomy tube. Gastrostomy is the creation of an artificial external opening into the stomach for nutritional support or gastric irrigation. Which of the following indicates accurate measurement of nasogastric tube to be inserted? A. Tip of the nose to the earlobe and down to the xiphoid process. B. Tip of nose to earlobe and down to sternum. C. Mark the tube at 10 inches. D. Mark the tube at 40 inches. And the correct answer is A. Tip of the nose to the earlobe and down to xiphoid process. Most accurate measurement of nasogastric tube to be inserted make from tip of nose to earlobe or tergus and down to xiphoid process. At the time of insertion of nasogastric tube, the position to be given to the patient is A. Supine position. B. High Fowler position. C. Prone position. D. Sims lateral position. And the correct answer is B. High Fowler position. At the time of insertion of nasogastric tube, place the patient in Fowler's position or in a sitting position with the head inclined forward. It facilitates forward movement of nasogastric tube. Before feeding the patient by gastrostomy tube, the nurse should A. Place the patient in semi-Fowler position. B. Slowly instill 5 ml of water. C. Provide the patient with pacifier. D. Aspirate the tube. And the correct answer is D. Aspirate the tube. Accurate placement of nasogastric tube is checked by the method except A. Stomach content aspiration. B. Checking the pH. C. X-ray. D. Palpation of the stomach. And the correct answer is D. Palpation of stomach. By palpation of the abdomen, nasogastric tube placement cannot be confirmed. An unconscious child requires intermittent nasogastric feeding. When should be the nurse check placement of the tube? A. Once a day. B. at every shift change? C. Before administering every feed? D. During the night shift? And the correct answer is C. Before administering every feed. Every time before giving feeding, make sure that the tube is in right position by aspirating a small amount 5 ml to 10 ml of stomach contents. Tube feeding should be delayed if amount of gastric content exceeds A. 20 ml, B. 25 ml, C. 30 ml, D. 50 ml. And the correct answer is D. 50 ml. Withhold the tube feeding if the amount of gastric content exceeds 50 ml. Although it varies according to hospital policy, so follow hospital protocol. Tube feeding diets are administered to hazards of A. Indigestion, B. Regurgitation, C. Flatulence, D. Distension. And the correct answer is B. Regurgitation. By the gastric gavage, hazards like regurgitation, venous thrombosis by parenteral nutrition, and chances of aspiration can be prevented.